My name is Ken Tassif, and I'm the Compliance Program Manager for the San Luis Obispo County Health Agency. This training is intended to address the agency's obligation to train on topics related to laws and regulations governing healthcare services in the public sector. But as you go through the training today, I'd like to ask you to think about how the concepts you learn apply to the trust our clients and the public place in us as we provide a broad array of services. This training was modified for the health agency's contractors and network providers to help you as partners comply with the same statutory requirements for training that the health agency complies with. As you go through this training, you may see or hear a reference to the health agency. Please assume that this includes our contractors, network providers, volunteers, or other individuals who do business under the health agency's umbrella. As employees of a healthcare provider, we face a multitude of laws, regulations, and policies related to services we provide. In fact, the healthcare industry may be the second most regulated industry right behind nuclear. In addition to state and federal regulations, we have policies that provide additional guidance on regulatory issues. All this can be a challenge for employees who must comply with all these laws and policies while focusing on your employee's mission. But understanding the regulations and policies supports your employer's core value of integrity. Remember that integrity includes uncompromising honesty in our dealings with the public and others, and it includes a commitment to maintaining the public trust. More importantly, integrity is the core to successful relationships with our clients and our coworkers. Integrity drives trust, which generally results in better outcomes. Understanding the regulations and policies helps us comply with the law, and it supports our mission as a healthcare provider. The objectives of this training are fairly simple. Because we are introducing our compliance program agency-wide and to our partners, I want everyone to understand what a compliance program is and why we need one. I want to explain how compliance programs have evolved over time, and I want to share with you the 7 elements of a successful compliance program. Lastly, I'll introduce the newly updated Health Agency Code of Conduct, which extends to our contracted providers. So let's start with an explanation of what a compliance program is. A compliance program is a framework of principles, policies, and actions that guide how an organization conducts its business. Essentially, it's a roadmap for ethical behavior. The compliance plan is the written document that explains how the health agency and its contract providers will support ethical conduct and compliance within the law. In addition, the compliance plan includes a set of tasks and audits that support the overall compliance program. A copy of the health agency's updated compliance plan is posted on the intranet. This slide will pause for a moment, and you can click on the link to bring up a copy of the compliance plan and code of conduct. You can print it out or show it on your screen during this training. Hit continue after you've accessed the document. So why do we need a compliance plan if we already have a core value that says we'll be honest in all of our dealings? Well, the short answer is because it's required by our contract with the state of California to deliver healthcare services. The contract says that we and our subcontractors must have a compliance plan as required by Section 6032 of the Federal Deficit Reduction Act. That act requires federal health programs to put into place policies and procedures that are designed to prevent fraud, waste, and abuse. In addition to our contractual requirements, the compliance plan is a critical element of the federal sentencing guidelines. I'll explain what that means in a moment. So while there are legal and contractual reasons for us to have a compliance plan, I really feel that the most important reason is to provide us a roadmap for success and for our employees to have a clear direction on how to conduct business in an ethical way. Lastly, the federal sentencing guidelines say that if we have an effective compliance plan and we still have a violation, we'll get credit against any penalty that may be levied against us. Let's talk a little about how compliance programs and plans have evolved over time. Back in 1984, Congress enacted the Federal Sentencing Reform Act, which was intended to correct disparity in the way sentences were applied for various violations. Back then, white-collar crime generally was not sentenced as seriously as other types of crime. In 1991, a commission was established and the first set of federal sentencing guidelines for organizations was established, placing criminal liability on individuals in corporations or other entities who are responsible for compliance with the law. You may remember back in 2001, the 6th biggest energy company in the world, Enron, had a financial collapse. For years, they had been illegally overstating profits, and senior management was being paid large bonuses. After a whistleblower exposed the wrongdoing, the stock plunged from $84 a share to less than $1 per share. Senior management knew of the impending collapse and sold their stock at high value, while other over 100,000 investors were caught by surprise and lost their entire investment. When the federal government investigated, they found rampant fraud with no plan to prevent it. Both Enron and their accounting firm, Arthur Andersen, had conspired to falsify financial records, and as a result, the federal government shut down both firms. After years of trials, numerous conspirators went to jail. It was one of the first and most publicized applications of the federal corporate sentencing guidelines. In the wake of the Enron scandal, Congress recognized that serious penalties were not enough to prevent corporate crime. So in 2004, they enacted compliance program criteria. The sentencing guidelines were amended to allow credit for organizations that voluntarily implemented an effective compliance program. In those guidelines, they detailed 7 elements of an effective compliance program. Shortly after the compliance program criteria was established, the Federal Deficit Reduction Act mandated compliance plans for any program receiving federal health care dollars. Let's talk about the 7 elements of an effective compliance plan. The first element relates to policies. We're required to design and implement effective policies that communicate how we will comply with regulations. Second, we need to train our employees on those policies. Having policies that no one's aware of doesn't make much sense. Third, we need to designate a compliance officer, that would be me, for the health agency. Fourth, we need to have open lines of communication between staff, management, and the compliance officer about compliance-related issues. Fifth, we need to monitor and audit what we do to ensure that we are in fact complying with the law. Sixth, if we do find a violation, we need to have a plan to address violations or offenses. And lastly, we need to enforce disciplinary standards and let our staff know about the standards. Let's examine these 7 elements a bit closer. The first element of the plan is to design and implement effective policies that explain how to comply with regulations. Throughout the health agency and our partners, we have policies and procedures that do just that. Whether the policies are related to client care or billing procedures, they give staff direction on how we must do business. We generally make these policies and procedures available on the intranet or on the internet or one of the network drives so employees can access them easily. The plan also requires the health agency and our partners to review policies periodically. While we don't always make changes during a review, we always check to ensure the policy is still accurate and relevant. In addition to the various policies and procedures we use throughout the agency, we have a code of conduct that's required to be part of the overall compliance plan. I'll introduce the code of conduct after we complete the discussion about the compliance plan. The second element of the plan is to train and educate the workforce on our policy. Let's face it, having a bunch of policies without sufficient training doesn't make sense. As you know, here at the health agency and at our partners, training is delivered in various ways. We use Relias Learning, live training such as the Linda Garrett Law and Ethics training. We occasionally watch webinars, and sometimes we go to out-of-town training. Some of the compliance training you may have taken on Relias Learning include Health Information Privacy and Security training, or HIPAA training, discrimination harassment training, cultural competency training, and of course this compliance training. The third element of the plan is to designate a compliance officer, and that would be me for the health agency. My job is to ensure that we have effective compliance programs that support ethical conduct. I'm certified by the Healthcare Compliance Association to develop and manage compliance programs. Many of our partner agencies have designated compliance officers. However, some are small enough that the top manager is charged with compliance. The important thing is to know who you can turn to if you have questions about compliance issues. The fourth element of the plan is to have open lines of communication between staff, management, and the compliance officer. For example, the guidance requires that staff is made aware of who the compliance officer is and how to contact the compliance officer. Employees are encouraged to report any ideas, risks, or violations to any level of management or to the compliance officer. In fact, here at the health agency, we maintain a toll-free hotline so that employees are able to communicate 24 hours a day, and they may do so anonymously if they choose. Here at the health agency, we use the same hotline as the auditor's office. Our hotline number is a toll-free area code 855-326-9623. And employees can feel confident that they can make a report without fear of retaliation. The bottom line is that we want to hear from you if you have any ideas, suggestions, or concerns. It's also important to know that if you know of a violation, it's your obligation to report that violation. The fifth element of the plan is to have an internal monitoring and auditing program. It really isn't enough to simply put in place policies, train our employees, and give them open communication. We also need to do spot checks to ensure the regulations and policies are being followed properly. Whether the monitoring involves checking email traffic or doing a Medi-Cal billing audit, the goal is to detect small problems before they become big problems. Some of the things we monitor or audit on a regular basis include quality of client care, access to computer systems throughout the agency, disclosure of PHI to other entities, appropriate billing of Medi-Cal or Medicare services, cash handling throughout the agency, and travel expenses. Occasionally, a program you participate in may be the subject of an audit, and you may be asked questions or be required to provide information to the auditor. It's important to remember that this is simply part of our ongoing compliance plan, and your cooperation, while required, will help the auditor complete the audit quickly so you can get back to your core duties. The sixth element of the plan is to respond to violations and correct them. The most common violation we respond to is a breach of client confidentiality. When that happens, we notify the client that their health information was breached, and we also report the breach to the state and federal agencies in charge of HIPAA. Occasionally, an audit will find that we had a billing error to Medicare or Medi-Cal. In those cases, we notify the appropriate agency and we refund the money to the agency involved. The seventh and last of the plan elements is to have disciplinary standards in place and to let our employees know that violations of regulations or policies do have consequences. We recognize that this can be uncomfortable for employees, but it's important to remember that the disciplinary standards are fair and they follow your employer's disciplinary policies. This means that a mistake like causing a privacy breach because you misdialed the facts will result in far different action than if you were to maliciously post an ex-spouse's medical records on Facebook. In the first case, the results may simply be a discussion with your supervisor, whereas the latter example may result in termination and, quite frankly, criminal prosecution. While most violations will require some form of written documentation, it's frequently simply an email memorializing the conversation with your supervisor. Remember, like the sixth element, this seventh element of the plan is simply part of the effort to prevent violations from recurring. Before we go on to introduce the Code of Conduct, let's recap the compliance program and compliance plan. Remember, the compliance program is the framework for the health agency and your employer to comply with laws and regulations, and the compliance plan is the document that articulates how we'll do that. It's every employee's job to support the compliance program, and it's every employee's obligation to report violations. There are 7 elements of the compliance plan, and each element supports identifying or preventing policy violations or violations of the law. You can access the health agency's compliance plan on the health agency's internet page. At the bottom of the page is a contractor network provider resource link. Of course, if you have any questions, please ask your supervisor or feel free to contact me at extension 4788. That's 781-4788. Now let's talk about the updated Health Agency Code of Conduct. The Health Agency's Code of Conduct is a collection of policies, standards, and practices intended to provide guidance to employees on ethical conduct in the health agency. Its foundations are rooted in the health agency's core values, which are integrity, collaboration, professionalism, accountability, responsiveness, and compassion. So how does the Code of Conduct work? As you know, there are employee conduct policies and standards at the health agency and also at your organization. We've taken the most relevant health agency policies and standards and unified them into a single code of conduct so that employees can easily refer to them. Every employee of the health agency and our contractors is expected to read and know the code of conduct. Your employer likely has additional conduct policies that you must comply with. However, we believe that the policies outlined in this code of conduct universally describe ethical conduct and support best practices in healthcare. If you don't have the code of conduct to refer to during this training, I suggest you pause the training and either bring it up on your screen or print it so you can refer to it while we discuss its contents. There's a link on the 4th slide of this training, but you can also access it by going to the Contractor and Network Provider Support link at the bottom of the Health Agency Internet page. The Code of Conduct opens with a reminder of the health agency's core values. It then goes on to the policies and standards that apply to our staff. These policies are grouped into 5 broad themes, which are respect for others, conflicts of interests, handling of transactions, assets, and cash, confidentiality, and a last catch-all category we call other standards of conduct. Let's start with the health agency core values. They are integrity, collaboration, professionalism, accountability, responsiveness, and compassion. These values form the basis for our ethical and responsive approach to our business. They're also the foundation for an effective code of conduct. The first broad grouping of policies and standards supports respect for others. These policies include a prohibition on discrimination and harassment in the workplace. This is not only a conduct policy, but it's the law, and employees who violate the rights of others by discriminating or sexually harassing them could face serious civil and criminal penalties. This grouping also includes cultural competence training. Employees in behavioral health are required to take extensive training on this subject and to provide services to clients that honor cultural beliefs, interpersonal styles, attitudes, and behaviors. Effective interpersonal communication in the workplace is the next standard in this group, requiring that our interactions with others be conducted with respect, courtesy, and consideration. We should treat each other in a way that supports positive relationships. Lastly, the violence prevention policy states that the county and your employer have zero tolerance for violence or threats of violence in the workplace. The next broad grouping of policies and standards relates to conflicts of interest. Remember that the original reason for compliance plans was to address waste, fraud, and abuse of public money. The policies in this grouping give employees direction that will help avoid such abuse. The first policy in this group addresses kickbacks and commissions. Employees are not allowed to receive commissions or other payment or compensation for business conducted for your employer. In other words, for doing your job, except as authorized under your employer's policy. Employees can't refer a client to themselves or to a vendor with whom they have a financial or personal relationship without disclosing the relationship and getting permission from their supervisor in advance. Lastly, employees who have a second job or receive outside compensation must notify their supervisor immediately and declare their second employment so that their supervisor can determine whether there is a conflict of interest. The next broad grouping of policies and standards relates to the handling of claims, transactions, assets, and cash. Again, this is core to the prevention of fraud, waste, and abuse. The first policy and standard in this grouping is the Claims for Services policy. This policy states that employees must ensure that their claims for services are accurate, timely, and consistent with all applicable laws. Falsifying claims to the state or federal government is a very serious violation, and the consequences can include personal fines and criminal charges. If you are ever unsure about how to code transactions or claims for services, you must consult with your supervisor. Other policies and standards in this grouping include the travel expense and general expense reimbursement policy. Employees must follow their employer's policy regarding travel and expense reimbursement closely. Employees who handle cash or credit transactions must be sure to follow their employer's cash handling policy very closely as well. Similar to the cash handling policy, the purchasing policy gives direction to employees on purchasing decisions. All of these policies related to money are regularly audited by your employer's accounting staff, and failure to follow these policies closely is grounds for discipline up to and including possible termination. Lastly, within this grouping is the standard on use of your employer's assets. Your employer's assets are intended for business use. It's not acceptable to borrow a laptop, camera, or medical equipment for personal use. If you ever need to use something from your employer for personal use, be sure your supervisor is aware and has approved. The last broad grouping of policies and standards is really a catch-all of miscellaneous policies that guide us on a variety of topics. The first policy I list is the Privacy and Confidentiality policy. You should have received training on this topic earlier this year. Please be aware that privacy and confidentiality of protected health information is one of the core elements of trust in a healthcare environment. The penalties to an individual for breaching a client's privacy can be very serious, including substantial fines, potential criminal charges, and civil liability for damages. The next standard listed relates to mandatory reporting. While many of our employees are mandated reporters based on their licensure or certification, we expect all employees to report knowledge of child abuse, elder abuse, threats of violence, or other risks to our clients or staff. The list of excluded individuals policy requires employees to tell management if they have been notified that they may or have been placed on the state or federal list of excluded individuals. This is rare, but it's part of the government's attempt to prevent fraud, waste, and abuse. The standard for handling of business records gives guidance on how to handle all documents and records. It's critically important that all business records are preserved and that they're not altered. In addition, employees are expected to retain all records consistent with the record retention schedule. Your employer's business records are extremely important, and we must ensure that they are correct and preserved. Lastly, all employees who are required to possess a driver's license, professional licensure, or certification as a condition of their job must maintain the licensure or certification consistent with their licensing or certifying board. Employees must notify their supervisor anytime their license or certification has become restricted. The last section of the Code of Conduct describes two important principles. First is the prohibition on retaliation, and the second is the requirement that all employees must report any activity that violates this Code of Conduct. With regards to retaliation, your employer prohibits retaliation for any individuals who report a violation to management. It's important to understand that employees are protected even if they complain about you. Conversely, you can be assured that retaliation is prohibited against you if you report a violation to management. In addition, it's important to remember that all employees are required to report any material violations of this Code of Conduct. We trust you to use your judgment about what you should report, but reporting material violations is the best way to reduce risk to your employer and minimize damages to staff, clients, and others. So to wrap things up, our compliance program is the set of principles, policies, and actions that guide how we conduct business consistent with laws, rules, and regulations, while the compliance plan is the roadmap for how the health agency and our partners will execute the compliance program. Lastly, the Code of Conduct is the set of policies, standards, and practices that guide our employees' ethical conduct in the workplace. By understanding the compliance plan and by following the Code of Conduct, we can help ensure that we provide services to clients in a manner that is ethical and complies with the law. At the end of this training, you'll be asked if you read the Code of Conduct. All employees are required to read the Code of Conduct and to comply with the requirements contained in it. The county's contract with the Department of Healthcare Services requires employees to affirm their commitment to compliance with applicable laws, regulations, and policies. At the end of this slide, the training will end and you will be taken to a screen where you can take a final exam. Simply click on the Start button next to the words Final Exam. The final exam is simply one question asking if you completed the compliance program training, read the Code of Conduct, and agree to comply with applicable laws, regulations, and policies. By clicking Yes, your Relias transcripts will be updated to reflect completion of this training. At that time, you can also print out a certificate for those of you who are able to apply for CEU units. Generally, those are employees who have BBS licensure. If you have any questions about the content of this training or navigation of this program, please speak with your supervisor, or you can call Ken Tassif, the Health Agency's Compliance Officer, at 805-471-5455. Thank you for your commitment to compliance with the law and commitment to ethical conduct at work.